Dr. Aiden Foster, who was in mixed practice for several years after he qualified. He's a diplomat of the American College of Veterinary Dermatology. He's a senior lecturer in veterinary dermatology at the University of Bristol.
Right, well, it's a great pleasure to be here. I'm here partly on the behest of Tim Nuttall, who sadly can't be with us today, and I'm very grateful for the Royal College for giving me the opportunity to share with you something that I feel quite strongly about, and I suspect, like many of you in the room, I wear several hats. So one of my hats is I have an affiliation with the University of Nottingham. So since I'm going to mainly talk about small animal related issues, I'm sort of wearing my mainly small animal hat, which is linked with Nottingham. But I do work for the Animal Health Veterinary Laboratories Agency as well. That's my day job. And I do have a training in dermatology, so much of what I'm going to say has a bearing on things to do with the skin. Part of my background interest in this is that a few years ago I went to a meeting at the University of Bologna, which was on veterinary evidence-based medicine, and shared a platform with Mark Holmes and others, and presented a presentation about a randomized controlled trial meta-analysis for canine atopic dermatitis. So I do have some background interest in this as an author, but I mainly have an interest as an editor. And it's quite gratifying for me to see a number of editors in the audience, because we have quite an important role to play, as I think we all do, in getting involved in evidence-based medicine. And certainly Veterinary Dermatology as a journal has been extremely interested in randomized controlled trials and systematic reviews. But I just want to make a little plea that everybody can contribute to this process, and certainly in AHVLA we use data from practitioners submitting samples to help give us surveillance data. And the reason why I put this in is I'm reminded by the evidence pyramid that we have a pyramid for surveillance data and the quality of it. And at the bottom of that pyramid is submissions from practitioners. So this series of photographs shows you, if you look at the red dots, diagnoses of liver fluke in cattle. And over time, as you move from the left to the right-hand side, you can see that the number of spots increases. And one interesting area that has increased in the number of spots is Norfolk. So a few years ago, if you were a practitioner, you didn't assume that you would see much liver fluke in cattle, but now you would. And I think one of the challenges we have for using this and other data is how we translate it to general practice. So, dermatology. Dermatologists are mainly dealing with small animals, mainly dealing with a variety of diseases such as allergies, infections and parasites. And in recent years there's a group that's now called the International Committee for Atopic Diseases of Animals, which has done a variety of systematic reviews and analyses which have been mainly published most recently in the Veterinary Dermatology Journal. This expert group is a large group from around the world and generates some interesting questions. Can they monopolize this area? And what, if any, sponsorship should they have? And who should they have the sponsorship from? And what impact might that have on the quality and the credibility of their work? Canine atopic dermatitis is a very common disease in small animal practice, in small animal dermatology. And Thierry Olivry has led this ICARDA group over the years and done at least one study which was based on the Cochrane-style study, and that was published in VetDerm in 2010. And the reason why I've put open access is to raise an interesting question about how do we disseminate information about clinical disease. There are several reasons why I made this article open access. Firstly, the journal is owned by the European Society of Veterinary Dermatology, and they want practitioners to know about this disease. But also, do we have a duty of care to let owners know more about this disease, so they can access the information as well, potentially. But there is a potential drawback. It's a huge, huge article. And many people would find such a large body of information quite difficult to read, digest, and work upon. The 2010 study was based in part on a 2003 study, which wasn't a Cochrane style, and both of these studies have helped to develop some clinical guidelines. Now, interestingly, we were invited to make these open access, and we have, and they've been published in about 20 different languages. So anybody can access them off the web and read the whole paper in their own language. Is that what we should be doing in the future? Well, it's not just the dermatologists who are busy looking at evidence-based reviews and randomized controlled trials. It's also a variety of other disciplines within small animal medicine. So the oncologists in particular are doing a lot of work, and they indeed have got lots of studies that they have to publish in the public domain. We've also had a hint already about the orthopedics, orthopods. These are people dealing with chronic disease like the dermatologists, and they too are looking at systematic reviews and evidence-based reviews. And some people may feel that there's not a lot of information out there. As Tim has hinted already with the equine world, maybe there is. And I think Douglas will talk a little bit about his systematic analysis of the literature to show that actually there is a lot of information out there. I think one of the challenges is, what's the quality? How useful is it? How can we adapt that into general practice in particular? Now, for an editor like myself, an important feature of reporting randomized controlled trials, given that a lot of dermatology involves clinical work, therapeutics, is the so-called consort statement. So, as ever, we look at the medical profession and see what they have done, and then we adapt as best we can. And in recent years, Annette O'Connor and colleagues have published in the journal Veterinary Internal Medicine and in a variety of other journals the Reflect statement, which is an attempt to provide guidelines by which authors should publish randomized controlled trial work in livestock. And it's intriguing that we don't have companion animal guidelines. Even though a lot of practitioners work in that field, the first set of guidelines came from the livestock world. Many of these authors have an interest in epidemiology and have been quite important in driving forward these guidelines. And the authors and the readers of these articles, if they're based on the Reflect statement, have a whole load of checklists, a whole load of items in the checklist to think about. This is quite intimidating to many people to go through this series of items and think, has my study fulfilled these requirements? So it's quite a big ask, but one would hope that editors and others will band together and say to authors, to commercial organizations organizing clinical trials, we would like you to follow these guidelines. We want to improve the quality of the studies, and we want to improve the way in which they're reported so that they're more easily accessed, perhaps, but certainly analyzed. And it may interest you to know that there is a companion animal group who are thinking about putting together some companion animal guidelines. This is an international group that met for the first time last year. It's very much driven by colleagues who are heavily involved in Journal of Veterinary Internal Medicine, Ken Hinchcliffe and Paul Morley in the States. And the name of the group that they've come up with is the Companion Animal Reporting Expectations and Standards for studies evaluating therapeutic interventions. This is meant to be for dogs, cats, and horses, and possibly other species in the companion field as well. It'll be mirrored very much on the same guidelines as the Reflect statement, and then there will be documents that are explaining and giving examples of those guidelines. It's going to take us a while to pull this together. It's going to take us a while to draw together the oncologists, the epidemiologists, the dermatologists, the equine people to agree. And we do pretty much agree on a lot of things. But the challenge for editors is getting people to follow these guidelines when they devise their studies and try to report them. But certainly from the point of view of it, for clinicians who want to see good quality evidence, we would hope that they'll be able to read good randomized controlled trials that have been reported in this way. And then we can use that trial work to do further analysis. As I say, we tend to adopt things from the human field. Here is a very quick example of a responsibility not just for the authors, but also for the readers as well. In recent years, we've noticed, thankfully, that authors are increasingly including in their clinical trial data intention-to-treat analysis. Now, in the human field, this is regarded as important because there are patients who start a trial and drop out. And you should really include their data in the analysis. So, the same in the veterinary field. You can get quite different results if you just use the animals that have gone through according to the protocol, the animals that finished the study. It's important to use the animals that started the study and went through some of the procedures. This may give a more meaningful data set. So there are, therefore, a number of requirements for the authors and the readers when it comes to putting these manuscripts together. The randomized controlled trial analysis work that we published a few years ago, what did it do for those in practice? What value had it for clinicians? Well, it helped you assess which drugs you might use in atopic dermatitis. It might also help give you some inclination as to the evidence, the strength of the evidence, and possibly the cost as well. But perhaps more importantly, given that many of the authors of this article and of the trials that it analysed would be based in specialty practice and/or academia, it helps to provide some implications for research. And these implications for practice and for research are very much outcomes expected of the Cochrane-style reviews. So perhaps this is a good example that we could perhaps try and apply to veterinary medicine. We acknowledge that there is often insufficient evidence of efficacy, but that doesn't mean that the drug isn't efficacious. It just means there isn't sufficient evidence. We have a variety of challenges in terms of working out what outcome measures should be. How do you measure how pruritic a dog is? How do you measure how severely affected they are? Are your studies of large enough size? Do you know that the drug is absorbed? Some antihistamines have never been properly studied in dogs. We give them to them. We've never done pharmacokinetic studies to prove that they're absorbed. So these analyses of randomized controlled trials help to inform further research, hopefully. And certainly in dermatology, there's been a number of them now that have helped to focus our minds on where we should go with clinical research. But we have to acknowledge that many vets work in a commercial environment. And many vets, especially veterinary dermatologists, have significant links with commercial sponsors. And one of my mentors, a very inspirational and funny and informed speaker, is Howell Williams, who's a professor of dermatology at the University of Nottingham. And Howell is very keen on promoting conflicts of interest. He's also very good at explaining evidence-based medicine to vets. And you might be able to read in this, it says, I think somewhere, that a conflict of interest is a condition and not a behavior. Vets are struggling, I feel, to appreciate the importance and the value still of declaring their conflicts of interest. There are very detailed guidelines in the human field. My colleagues on this paper on the left, the interventions paper, the box in red shows you their conflicts of interest. It's as big as the abstract. How many authors declare that number of drug company affiliations? It's not a problem. They're not biased. All they have to do is to declare it. So here is a responsibility, I feel, for authors. Don't be afraid. If you're not sure, declare what you've done. Now you can go down to minutiae. How many drug companies have you had dinner with? The other onerous responsibility, perhaps for authors, is that you've done a review and then there's some more studies published. So you have to update it. So the study on the right is Thierry Oliver's update, which we'll publish early next year. Because new work comes along. It may change the outcomes, the conclusions. So this is a lot of work. All of these papers are very, very large studies, very large papers. But the evidence is accumulating. So then, what are the responsibilities for authors? I feel that we have an obligation to encourage authors to declare conflicts of interest. And I'm sure this occurs not just in dermatology, but in other fields as well. We have to be clear about our sources of funding, what was paid for. And we have to be mindful that there are guidelines in place at the moment. They're not very thoroughly applied. There may be new guidelines in the future. So authors have a responsibility, I feel, to fulfill some of these obligations. And what do we as readers potentially have to do? We have to understand what intention to treat means. We have to understand what RefMan software might do if you do a meta-analysis, maybe. And we have to appreciate the potential weakness of some of these high-level studies. Requires a critical analysis of some of the original papers and of the summary review papers. So that's quite a big ask, isn't it, for some readers? And I think I've said to somebody already today that one of the things I find quite depressing is how practitioners who have an expressed interest in dermatology don't even read some of these big papers because they're too big, they're too complicated. Why is that? And then we can frighten you with the future. What is the future? Well, the future is very mathematical and sits probably in the hands of the epidemiologists and people like Annette O'Connor. Now, Annette's just presented a paper at the American Association of Bovine Practitioners last month, which is entitled Using Mixed Treatment Comparison to Compare Interventions, a research synthesis using antibiotic treatments for bovine respiratory disease. Now, Annette wants to apply this methodology to small animal. So what we're trying to do here is we're trying to assess a variety of analyses, not just randomized controlled trials, and synthesize them together to come up with some clues as to which drugs really do work or not. The medics have had to do this for a while. Here's a recent example from the BMJ where they're looking at randomized studies and observational studies. Now, these papers get very mathematical if you look at them. They're quite intimidating. But what I'm hinting at is that there are tools coming up that we may need to use in the future to try and dissect some of what we might term poorer quality material if we use the right tools. A lot's been written about evidence-based medicine in the veterinary field. Here is a recent editorial from the Veterinary Journal from Simon Moore in Dublin. And what he's alluding to here is another paper in the journal, and it talks a bit about how do we deliver the evidence. And I would contend, certainly in dermatology and perhaps in some other disciplines, there is a bit of an evidence build-up, there is evidence accumulating. But I think there is a major challenge in how we translate it, in how we deliver it. And who are we trying to deliver it to? So, to finish off, I'll put up a slide. I thought, well, we're with the Royal College of Veterinary Surgeons. I'll go and have a look at what it says about evidence-based medicine on their Certificate in Advanced Veterinary Practice syllabuses. And it is there. It does use the term, but I'm not sure how much detail is expected here. So I'm going to finish by posing some questions. We are assuming, we're expecting that Nottingham and others, and I'm part of that extended family, so to speak, trying to help undergraduates understand what evidence-based medicine is. And they may well be the diplomats who help to disseminate this information. As David said with EMS, there are opportunities there for undergraduates to tell us about what evidence-based medicine is. But when we look at postgraduates, postgraduate qualifications like the RCVS certificate and other bodies that provide postgraduate education may have a duty of care to look carefully at what they mean by evidence-based medicine and do they actually help to deliver it if we think it's that important. I've also wondered what specialists should do, because I sense that with some of these large papers that people see in the literature, that they don't really want to read even the abstract. They get lost after the introduction and the methods are completely gaga. All they want is the bottom line. So it may well be that specialists need additional training or support or encouragement to know how to dissect out what these studies mean and help to disseminate the information when they're doing CPD in their practices and to people in the wider field. And I suppose in general what most of us are interested in doing is trying to disseminate some of this information to people in the general world, the practitioner. The very, very busy practitioner who's got a very few moments on the computer to grab something and hopefully inform his decision about the dog in front of him. Maybe that's not the best approach. Maybe it needs to be a more concerted effort. But we have to appreciate and understand that if practitioners are to pick up and understand evidence-based medicine or the outcomes of it, that we've got to accommodate somehow this lack of time, lack of resources that they've got. So I'm sure that's part of the discussion we might wish to have. What role do we have for undergraduates, for postgrads? What role indeed do we have for veterinary editors, veterinary journal editors? So I feel the evidence base is growing, but I think we've got a lot more to learn about how to translate that evidence into the wider market.